What brought me to Balance Physical Therapy? I was sent to the ER for a extremely painful issue with inside of my hip. They did MRI with and without dye. They did CT scan. They did every test. No doctor there could figure it out. I went to a pain doctor. He sent me to Balance Physical Therapy. Stephanie saw it. She figured out it was probably my iliopsoas, and she came up with a specific set of exercises for it, and it was almost immediately feeling better, and after 6 or 8 weeks it was all healed up. Haven't had a problem since. What was my quality of life like before and after coming to Balance Physical Therapy? Well, prior to coming here, I was basically bedridden for a month. Agony, pain. I don't like to take a lot of pain pills, so it was basically just rolling over on my side and not knowing what to do, and seeing more doctors who didn't know what to do. And then after I came here, after my very first time, I started to feel a little bit of relief, and it was like 2-3 times a week. And I would say after 4 weeks, the pain was gone. Almost gone. I'd say 80% gone, and it was completely gone, and it's been gone now for 8 months. What was the biggest difference or change I saw at Balance versus the doctor? Well, since all of my time had been in the ER, I had been seeing 2 or 3 doctors. One doctor actually admitted me to the hospital. I was there for 2 days. He talked to me for 3 minutes total over 2 days. No other doctors talked to me. I asked to be discharged. He asked why. I said, no one's treating me. He said, okay, and sent me home. No direction. I said, do you know what's wrong? No. I came here, they did a full analysis. They checked my elbows, my shoulders, my range of motion, my abdomen, my legs, my hips, and that's how they were able to determine a multitude of issues that I have with my shoulders, with the iliopsoas, and my ankle, which is another issue that is now being addressed. And now I'm retraining my walk, which is curing the ankle. My question the question is what can physical therapy do to improve your quality of life? And what I can say is they basically take the time to understand what's wrong through a very detailed series of analyses when you come here. So they can read the doctor's reports, they can read the MRIs and all the radiology, blah, blah, blah. But they take that and then they go further and look in depth as to what's wrong, and then they actually provide you treatment. Whereas doctors today, all they want you to do is go. They have 15 minutes per insurance laws just to read about you, check you in, check you out, and get you out the door. So that's maybe 6 minutes with you. Whereas at physical therapy, you're going to be seeing the therapist for, depending on the doctor, at least multiple times, 10, 12 times, perhaps longer. My mom has come here and gotten significantly better with physical therapy. My sister has gotten much better with physical therapy, and my girlfriend continues to get physical therapy at a physical therapist. So physical therapy takes the time to learn about the injury, come up with a plan, and then repetitively works that issue until it's resolved.